Hi everybody. I am getting quite a few requests from you regarding back pain and what best to do when you get an acute attack of back pain. Lots of people are doing more gardening than they normally do. Some people are doing different jobs that they do. Perhaps they're lifting heavy objects and have injured their back. The first thing, of course, everyone is individual. That's why you have to seek physiotherapy help, because to give a generic response to back pain is really quite difficult. But fundamentally, when you are in such pain with the low back, first of all, you just have to ask yourself certain questions. You know, if you've got pins and needles or numbness in one of your legs, you know, that is not great, and it means there's some nerve involvement, some pressure on the nerve. If you're just getting referred leg pain, it could be that just the inflammation, the acute inflammation that's going on at the moment is putting pressure on structures, which can give that referred pain. But if you've got pain down your legs, one has to be really quite careful. If you've just got straight low back pain and no pins and needles or numbness, the first thing to do is perhaps put some ice on it or some heat. Bag of frozen peas wrapped up in a wet tea towel. I know the research really now is about acute inflammation. You shouldn't be using ice, but it is so pain relieving. I think there's a benefit to it. Or you could put a hot water bottle on it and perhaps just lie down on the floor, just with your knees bent up, or you could actually have your feet up on a chair. Or you could, if you've got pain perhaps more on the left side than the right, you could lie on the right side, put a pillow between your knees because it levels you up, and just lie there for a little bit, just to ease it up a little bit. But the aim with back pain, even in the acute phase, is not to be too static. So you want to move a little bit. So little movements you could do are just trying to bring your knee up onto your chest, really gently, within your pain-free range. And then you could do just gentle movements, tiny little movements, just within the pain-free range. The whole aim of that is that you're just moving gently. That will increase the blood flow, help reduce the inflammation. So that's in the acuter phases, but don't ever go pushing into the pain. And then I will just show you a few little exercises, but again, these should be performed as you feel comfortable. So if you're thinking, gosh, that actually really does aggravate it, then just don't do it. Just wait a few days until it starts to subside a little bit. So what you can do is lying on your back, and you breathe in, and as you breathe out, you flatten the small of your back down into the mat, and then gently release. So you breathe in, and as you breathe out, you flatten the small of the back into the floor. And you just do that 5 times or 10 times. Build up to 10 times. The other thing you could do is just very gently roll the knees, gently. And then as you're able to take it a little bit further, you can take your arms out and roll. But again, this all in the acute phase of back pain, you really should be doing this within the pain-free range. And then you can breathe in. As you breathe out, just see if you can bring the knee up onto your chest. Again, you don't have to force it, just to where you feel comfortable, and lower it down. And then you can bring the other leg up and down. And then you could try and take your arms up above your head. Try and relax the shoulders, move the shoulder blades down, and just lie in that position and bring your arms. And then to get up, you always roll onto your side. Best to roll onto the, have the pain-free side uppermost. And then if you're on your bed, you could swing your legs down, or else just slowly try and kind of log roll. Yes, you're trying to keep the back without too much twisting, and then come up. And then gradually the pain will ease. But the most important thing is, if you have any serious issues, i.e. pins and needles, numbness, if you have any what we call cauda equina symptoms, so it's actually numbness between your legs, or you have any bladder and bowel issues, so perhaps you're having retention, you actually can't pee. These are really quite serious things and you have to seek medical help. So in the early phases, if you just follow those little rules and it gradually gets better and better, that's great. But otherwise, you really should seek good physiotherapy. And we're online, but lots of physiotherapy practices are online now. So I hope that's helping, or will help.